Hello, everyone. Welcome to my masterclass session, What is the digital equivalent of a smile? I hope you enjoy it. So many teams are obsessed with the number of HCPs attending the webinars. So currently in my experience, I have seen a lot of people really focusing on, let's bring as many doctors as we can to the webinar that I organized. And there's also a lot of focus on e-permissions. They're just really thinking about how many e-permissions we can get without having any regard of the preference of whether or not the doctor wants to give us their e-permission. And there is a lot of focus on also digital touchpoints. I have seen many KPIs in the teams that I have been working with on identifying or measuring how many touch points that are digital can we use to get to the doctors? But that may not be the answer, right? And finally, there is one more focus that I have seen, which is the number of campaigns executed. So these are the typical KPIs that I have been seeing in many teams currently. But in my opinion, these are just hygiene factors, right? This is not, they don't tell you anything, really. I mean, these are just numbers. If you know about number of e-permissions, that's just the number of doctors that decided to give you the chance to communicate with them through digital channels. Or if you say, how many digital touch points are we using to engage with a specific doctor? It's just how many things that you have done, but you don't really know if the doctors were happy with that. They're just numbers. So the focus of our efforts, it's about customer experience. I have been talking about this in other webinars and also with colleagues in the pharma industry. And in my YouTube channel, I have also talked about this. The focus of our efforts has to be to create customer experiences where the doctors engage with the content that is relevant for them in a time that it's convenient for them and in a format that it's convenient for them, right? So if the focus is on customer experience, then the measurement should be also measuring customer experience, right? So not measuring digital touch points or e-permissions, but rather how satisfied is the doctor or is the customer with the experience that we provided. So obviously, deliver tailored and memorable experiences. It's a long journey, right? So you have to think about what content you have to provide, but this content has to be also achieving the ultimate vision of helping the doctors to provide better care for their patients, right? Because in the end, if you think about how satisfied are your HCPs with that customer experience, that satisfaction and that, let's say, level of happiness that they will have based on the customer experience that you provide is going to translate into the quality of life of their patients, right? So if you provide them a positive customer experience, they will be effectively recommending better solutions for the patients, and that ultimately will have an impact in your business. So in this case, like I was mentioning before, think about it. If your customer experience has to be providing content through the preferred channel, the preferred format, and at the time that it's convenient for them, you have different questions at each of those levels, right? So you have to think about, for example, when you're thinking about providing content through the preferred channel, then the question that you have to ask to measure success is how and why are the channels that we're using performing? This is the question that you need to answer. Not how many channels are we using, it's how are those channels working? If you think about the preferred format, it's a similar story. You have to ask yourself, what are the formats that are more convenient or preferred by your HCPs? So for example, if you think that the doctors are going to respond better to an email that is delivering a video, that it's on top of that it's embedded in the email, then this is what you have to measure. If the video was really successful in delivering the message through that email, right? If not, then you have to think about the different format. But the important part is asking yourself the question, what is the format that is convenient for this customer? And finally, at a time that is convenient for them, so that you don't push them to join a webinar that is going to be very late at night or very early in the morning when they have a lot of patients, or in the middle of the day when they just want to have lunch. They don't care about joining a webinar at lunchtime, right? So instead of being obsessed with pushing them to come to a point in time that was more convenient for you, right? Because you maybe your speakers were available at 4 p.m., but your customers were not available at 4 p.m. So you are not being customer-centric in this way. So the question that you have to answer is, what time it's more convenient for them to engage with my content and to have a convenient customer experience? So how do we measure that, right? So in the slide, sounds very easy and sounds great, and everybody's talking about it in the industry, and we all like it. But the question is, how do we really measure that, right? This is the tricky part, because in face-to-face, you know exactly if your doctor is happy or angry or frustrated, right? You can see their faces, and this is a typical thing that we do in a face-to-face engagement. However, if you go to a digital world, then the question that we have to ask and that we want to answer today is, what is the digital equivalent of a smile? This is my question. This is what I have been trying to answer in the past several months to identify, how do we know if the doctor was happy with the engagement, or angry or frustrated, or didn't have any reaction to the engagement, right? And today we're going to give it a try. So let's start with success depends on what behavior you're trying to change or achieve. This is the beginning, right? It sounds really basic, but many people don't start here. Many people start with, what are the KPIs? What are the numbers? What are the click-through rates? Without regard of what is that behavior. So this is our starting point. If you don't start here, then you are already in the wrong direction. But let's assume that we all start here. What is the behavior that we're trying to achieve? So this is going to define, for example, if you want the doctors to open an email, this is a very basic example, right? The behavior that I'm trying to change is the doctors to open my email. Then my KPI should be measure email open rate. This is as simple as that. If you want HCPs to download an infographic of your study, then your measure should be download rate. Moreover, if you want the HCPs to watch a video, then you have to measure video view rate. And finally, if you want the doctor to switch the prescription from your competitor brand to your brand, then you have to measure prescription share. It's as simple as that. This is the very first stage of measuring success and finding the digital smile. What is that behavior that you're trying to change? If you start with that, you're already starting with the right foot. Now, to give context to all the KPIs, because we have, in the digital world, we have multiple KPIs, right? We have click-through rates, we have open rates, we have video view rate, bounce rate, net promoter score. There are multiple KPIs. And I always ask the question, what are the KPIs that are going to show you if you are really moving the needle, right? And this question that I always ask to the teams, it's because I constantly receive the same question. Chema, what should we measure? What are the KPIs for the project? What are the real KPIs that we should be tracking? And it's a very common question and very important question that we need to answer. And to get there, we need to use, from my perspective, my proposal is to use the engagement funnel. And this is going to provide us context. For this, we have to divide the funnel in 3 stages. The first one is going to be reach. The second is engage. And the third one is convert. And then we're going to categorize all the metrics throughout that funnel. So the first part, in the reach, you have all the doctors here that are going to be maybe not engaging yet with your content. You're going to send them emailings. This is the part when you actually kind of like bombard them, because you send them emailings, you send them WhatsApps, SMS, you put a banner in the places where you know they are, or maybe you use a social media specializing doctors into your ecosystem, right? So this is where you do the effort to try to reach the right customer through the right channel, right? And then here your KPIs are going to be different, right? Now they moved into the engagement part. Then they start to click. Now your doctors are happy, but not all of them are the ones that don't click. It doesn't mean that they're not happy. It means that they prefer a different type of engagement. So the ones that stay with you, that click and that stay with you in the funnel, they're keeping with you on a happy journey. Let's assume that. Because they said, oh, nice, this is a nice email. I'm going to click on it. I like it. I'm going to go into it. And then if you go to the next part, which is your doctors already opened the email. Now they're taking a look at it. You're having less and less doctors, obviously, because not everybody is going to engage in the same way with the same content, right? So it doesn't mean that you lose them. It means that the ones that are staying with you in the journey are happy with the content you're giving them. That's why the digital smiles that you see on their screen are still with you. So then they decide to click, and this is your click-through rate. Now they click and they go into a website, right? Where you see them there, they arrive and they start looking at your content. And maybe they are invited to a webinar. So they see a registration button, they see other videos, they see materials to download, and they keep going with your journey. In the next phase, they decide to register. They say, okay, nice. Here, the doctors are less and less, obviously, because again, you started here with a lot of doctors trying to reach them, but since not all of them are going to be happy with the journey, some of them are going to say, no, I drop out because I prefer another type of engagement. Maybe they prefer a face-to-face engagement and they are not interested in this one, but that doesn't mean that they're not happy. At this point of the registration, you have the doctors, a specific amount of doctors, a segment that it's doctors who like to receive emails, who were interested in your content, who found your webinar interesting, and who have time to register to the webinar. That's why they take the time to say, yes, I'm going to put my name, I'm going to put my email here, and I'm going to receive a registration to attend this webinar. But things are not over there yet. So you still have another phase where you will be going into how many people really attended. And again, it doesn't have to be that all of them have to attend. Obviously, some of them at the very last minute are going to be like, well, maybe I don't have enough time. Maybe I have a better thing to do. Maybe I'll just watch the recording later. So you will probably lose some of them in the last part. And again, not everything finished here, right? So many teams are obsessed. If you remember the beginning of my presentation, many teams are obsessed with this part. with only this specific part of the funnel. How many doctors came to my webinar? And they ignore the whole journey behind and then the journey ahead. Because after this, if you see what happens is that you still need to measure a net promoter score to see how much they will be able to recommend your content. You need to measure a customer experience score to identify how positive the experience was. You need to measure the engagement in the webinar. You need to say how many doctors responded to the polling questions I made during the webinar to identify who was really willing to give their opinion and maybe not just multitasking during the webinar. And finally, you need to answer if there was any positive change in their clinical practice, right? So you need to ask them if the webinar had any positive change in them. So this is, you see, this is a journey. It's not just how many doctors came to my webinar. It's a journey that you have to measure, a whole customer experience that you have to measure completely. So now I'm gonna give you a quick example on how this looks like with numbers. So as you remember in the funnel, it was coming from this side to this side, and then some of the doctors were dropping throughout the funnel because not everybody was happy with this type of engagement. So if you look at the first part, this is where you start reaching so many doctors, depending on which market you are, or even what is your responsibility, if it's local or regional or global, you're probably going to be in the thousands of doctors or hundreds of thousands of impressions. However, not everybody's going to engage with that, right? As you can see in this funnel, some doctors open the email or open the message, and then some of them click on that message, as I was explaining, and then you come to a point where you get to 20,000 doctors who visited your website. And these 20,000 doctors, only 12,000 register. So some teams, what I have seen is that they think that they lost 8,000 doctors because they didn't register. But this is not the case. Our job is to find out from those 8,000 doctors, what did they do in the website? What behaviors they had? Maybe those 8,000 doctors came and they found a video. And maybe that video was what they were looking for. Maybe they were coming to register and they said, oh, wow, this video is great. And this is exactly what I was needing. So I'm just going to leave the website now because I don't need anything else. That was a positive experience. It doesn't mean that you have to push them to come to the webinar because they don't have to. They already had a positive experience. And you need to have the proper framework to identify that those doctors coming to a website, finding a video, have to have a positive experience. You need to be able to measure that. Otherwise, you're going to be obsessed with bringing them to the webinar. And then the next part is the same. So from the 12,000, only 40% attended the webinar because of different reasons. It could be because they had the time. Some of them they forgot, or maybe they had different activities, or they preferred to watch the recording of the webinar later on, right? So, but it doesn't, so you need to start identifying the segments. If you think about it, we have a lot of segments throughout this funnel. And we are right now in this example, we're talking about 3. Those who came to the website and found a content that was useful and for them, and they didn't need to register. Those doctors who came to the website and registered, that's a different segment. And the doctors who came to the website, who registered, who actually attended, that is a different segment. And you can't keep going, because if you ask the net promoter score, you will see that there were some doctors who were promoters and some doctors who were detractors. So you have to identify this so that you can start tailoring the experiences. You can start identifying these digital smiles, and you can start activating upon those digital smiles. But this is the total population. So you see, this is a 65 net promoter score among all the doctors who came to your webinar. 21% of them were responding to the pollings that you made, and 90% of them had a positive impact in their clinical practice. Now, let's take a look at a different example that you will see now. Because if we really want to personalize customer experience, then we have to start measuring more granularly, right? Now, I'm going to show you a cardiologist funnel. So let's assume that now I'm going to show you the example of how cardiologists behave. So if you go to the first part of the funnel, you will see that it's the same case. Hundreds of thousands or thousands of doctors, because obviously the cardiologist universe is probably smaller. You come to a point where you have 2,000 doctors, and then 750 register and 80% attend. That's huge. But if you compare it to the previous exercise, so you will see that the percentage of attendance is higher. So then you have a better way to identify this. Now, you can identify that the digital smile of your cardiologist was higher or was more prominent in them. And even if you look at the Net Promoter Score, it was also higher than the total universe. So you can identify that you're moving the needle more in the cardiologists, right? Despite the fact that only 18% were engaging, they even also had a higher positive impact in their clinical practice. So this is much more insightful than how many doctors came to my webinar. If you remember my example, I keep sounding like a broken record, but this is true. I say it so many times because this is what we have to forget. Forget about numbers of doctors coming to a webinar and rather focusing on identifying that digital smile. But specialty level data is not enough. This is something I keep saying. Imagine that imagine that you were working in the consumer business in, I don't know, another company, and you were saying, the next campaign is going to be for architects, and then we're going to have another campaign for, I don't know, engineers. You will never do that, right? So you will have probably needs of consumers to identify specific subsegments based on behavioral data or on preference data, channel affinity. So specialty level, it's not enough. Within the specialty, there are different segments that we have to identify. And I'm not even talking about channel affinity. I'm talking about a level of adoption, channel preference, content preference, format preference. There are multiple things that you need to start thinking about how to connect with to micro segments within your specialties. So what I'm going to show you now is the example of an early adopter. So let's assume that within your cardiologists, there are doctors who are your early adopters of new brands, right? So you're going to see that the level of engagement that they have throughout the funnel is gonna drive you until the point where you get a Net Promoter Score of 92, which is even higher than the rest. You can assume that your segment, again, within your micro segment of early adopters, cardiologists, you are making a higher impact, even higher than in the cardiologist itself and higher than the total population. Now imagine if you had another segment, which could be late adopters. Maybe this is what you have to find out. What is the Net Promoter Score of late adopters versus early adopters versus prescribers of the competition versus, I don't know, key opinion leaders. So those are the things that you have to be answering throughout the funnel, and that are going to give you more perspective about what is the digital smile of your HCPs. And with that, I really hope that you found this insightful, and I really hope that I contributed to help you identify how to measure those customer experiences, how to identify if your HCPs are happy with the customers that you're providing, and that we are closer. We're probably not there. Maybe we are halfway through, or maybe we are halfway through, or maybe we need to do more work. But definitely, we are getting closer to identify the digital smile if we keep asking these questions. I hope you enjoyed, and I'm open for any questions in the session that you may have. Thank you very much.